Welcome and thanks for joining us. My guest today is Destiny Simone Ramjan, the Vice President of Community Health and Social Impact at CareFirst BlueCross BlueShield. Thank you so much for joining us today.
It's a pleasure, Nick.
We're going to talk mainly about grant funding, and we're really interested to hear about exactly what these grants are, what they're going to be spent on. Could you just tell us about this new round of grant funding for organizations that CareFirst recently announced? What are these grants for, where are they going, and why are they so important?
Sure. CareFirst is thrilled to have partnered with 19 organizations across the Mid-Atlantic region, including Maryland, D.C., and Northern Virginia, to invest $8 million to address the mental health epidemic among young people. Whether it's a pandemic or an epidemic, a part of what we wanted to ensure is that we were equipping the region with a behavioral health workforce, expanding the number of new hires able to deliver services, and then certainly thinking about the range of behavioral health continuum of services provided to young people in the region.
And this is a mental health crisis, you've called it, among young people. Can you explain what that means exactly?
Sure. Scientific American revealed a report last year, during the fall, about a year ago, describing the rising rates of suicide among young Black girls, including the fact that young Black women were committing suicide at twice the rates of young Black boys. That sort of brought me to a grinding halt. Yeah. Several weeks later, the U.S. Surgeon General issued a public health advisory describing the ways in which the COVID pandemic had exacerbated the behavioral health crisis among young people and calling the American public to action. So I'm really thrilled to work for an organization under the leadership of CEO Brian Pinnock that responded to the call in this meaningful and substantive way.
And it sounds like this mental health crisis that you're talking about is directly related to the pandemic. Is that what I'm hearing?
Yeah, absolutely. I would describe it as exacerbated by. Okay. So the range of behavioral health conditions include everything from sadness and hopelessness to substance abuse disorder, anxiety, depression, you name it. And so a part of what we've said is we want those investments to address the continuum of behavioral health conditions, which is to say that while there were certainly elements present prior to the pandemic, with all of us being home and young people disconnected from schools, parents that may have had to go out into the workforce and brave the COVID pandemic and more, those conditions were exacerbated by, so it made an already fragile condition even worse.
So these grants, you were talking about the mental health crisis. Are these grants specifically only for the mental health crisis, or are there other components, or how does that work?
Sure. There are two primary areas of focus for our investments. One is addressing behavioral health disparities among young people or at-risk youth. Certainly as we think about the continuum of care, rural young people are experiencing barriers in accessing services, while young people and LGBTQIA positive young people are experiencing barriers to accessing culturally competent care. So the first goal is to just expand the number of services that are available to be provided to young people. The second is certainly expanding the behavioral health workforce, recognizing that young people need to be able to access those services in a rapid, in a timely fashion. And so a huge part of what we're doing is creating net new jobs, ensuring that we are hiring around the workforce, but also looking at health professional shortage areas, or HPSAs. How do we place professionals in those locations where there's a dearth of services and make those more readily available and more frequently available?
Why would you say the issue of behavioral health is so significant that you've chosen to focus on it in this way? Is there anything in particular you can tell us about just why this is so important?
Yeah, as I think about rates of hopelessness, sadness, anxiety, and depression among young people and among the members that we serve, we see it on the rise. We also know that nationwide, there is an infrastructure issue with the behavioral health workforce. So part of what we've said is, how do we look at the data that drives those disparities and plan interventions and programs that directly address them? So really, ultimately, we follow the data. One other thing I might mention, Nick, is that when your house is on fire, you behave differently, right? You act with a sense of urgency. Right. You move quickly. And so a part of what the U.S. Surgeon General has said is the house is on fire when it comes to the the youth mental health crisis, and we want to be a part of returning our region to safety and recovery.
And that can be scary for parents to hear, I would imagine, and families with kids to hear something like that. They're probably maybe feeling a little uneasy just to hear those statistics.
Absolutely. You know, I think about some of the wonderful partners that are going to help deliver those services. I'm thinking, for example, about the Enoch Pratt Library, who is going to expand their peer support and health navigator network to ensure that even if an individual or a young person or a parent doesn't recognize the signs and symptoms of mental health crises, we want to be able to expand the number of people who are able to say, hey, maybe we want to talk to you a little bit about some of the services that we provide. You know, the reason that the Enoch Pratt Library, in partnership with the Maryland Peer Advisory Council and Healing City Baltimore, is rising to the level for me as this example is because, you know, sometimes when we think of mental health, we think of a psychiatric ward, for example, or we think of a licensed clinical social worker and I'm laying on the couch. Well, that's not how CareFirst thinks about its services, nor do the partners that we're investing in think about their services. Mental health, just like physical health, happens outside of your doctor's office, in places where we live, work, seek care, play, and pray. And what better place than alternate than traditional sites of care, such as a library, such as a farm, and more. So what we're hoping is that by extending the continuum of where services are provided, we can extend the number of people who can then recognize those signs and symptoms, wrap their arms around young people, their families, and more, and then work towards healing.
It sounded like you mentioned a couple of partners there as you were just talking. Can you tell us about some of the other partnerships stemming from these grants that you can think of?
Sure. I'm thinking of one of our most endeared partners, Sasha Bruce's Youth Work, who is going to implement services for homeless youth, for example. We know that Sasha Bruce has worked to provide behavioral health care for decades, and a part of what we've said is examining the social determinants of health. Certainly we want young people who are currently homeless to convert into a stable housed situation and ameliorate all of the psychological impacts of that. So we're really proud of the partnership with Sasha Bruce to help expand the number of services that they're able to provide, particularly for youth between the ages of 12 and 22. So when we say youth, we really do mean that sort of kindergarten to career, right? That full continuum from children to teens to adolescents and everywhere in between.
And how about advice to local businesses? What can businesses in the community do to address these behavioral health issues within the communities that you're referring to? What is their role in this overall goal and mission you're talking about?
Yeah, you know, I think we all have a role to play in creating healthier communities. A part of the role that employers play is certainly checking in and creating a healthier work environment. Our Chief Human Resources Officer, Angela Celestin, often talks about maintaining a healthy work-life balance, ensuring that we're examining productivity levels and disengagement among the workforce. So a part of this is sort of checking within. How are we creating opportunities for rest, rejuvenation, and relaxation among the workforce? And then certainly as we think about parents, right, this grant round is about addressing behavioral health conditions among young people. Some of that is re-examining the benefits offered, right, to our workforce and ensuring that we're creating easier on-ramps and off-ramps for parents who might have to pick their children up from school early, creating opportunities to examine wellness benefits, right, ensuring that we are creating healthy work environments and doing our part to contribute to a healthy community, I think then has a result in improving mental health and more.
And that's a win-win for businesses, I would think, because it improves productivity and probably morale also.
Absolutely. We think you couldn't be more right, Nick. A healthy and engaged workforce is a vibrant workforce, is a workforce who's excited to come to work each day and carry out the mission. At CareFirst, we describe ourselves often as difference makers. And a huge part of that difference maker identity are the values that we lead with. And that includes bringing your whole self, right? This idea of inclusion, empathy, and belonging. And bringing your whole self means to be able to say to your senior leadership, I don't have it all in me today, right? And so how do we examine what it means to create a cohesive work environment? How do we encourage our employers to think the same? And then how do we also put the right behavioral health resources in place for when things happen beyond the sort of workforce environment and extend into the clinical environment?
And how about nonprofits and community organizations? What can they do to get involved with all of this work?
Yeah, well, first, we love the 19 organizations that we've invested in. I mentioned a few of our partners. I'll also talk a little bit about the Center for Urban Families in Baltimore, which is going to extend the number of community health workers available in Baltimore communities to ensure that individuals who need help know where to get it, right? Some of this is that services are available, but it can be unwieldy to try to navigate that level of complexity. So how do we create more wayfinding opportunities so that services that are available are accessible and affordable to those who need it most? Also want to mention the Association for the Public Defender of Maryland, who's going to work to alleviate disparities among those who are potentially facing eviction crises and more. So this is a huge continuum end to end, and we think our nonprofits, the 19 organizations, are well positioned to continue to deliver on their mission, and CareFirst is proud to support them in doing so.
And it sounds like you have a lot going on, and you're talking about all of this grant money, all of these different efforts that you're working on at the same time. Do you think that you will be doing additional rounds of grants with behavioral health as a focus in the future?
Absolutely. Well, as I mentioned at the top of our discussion, I'm proud to serve as Vice President of Community Health and Social Impacts with CareFirst. Behavioral health is one of 6 focus areas that our portfolio collaborates to invest in. That includes everything from economic inclusion and educational opportunity to behavioral health, accessible, affordable, high-quality care, chronic conditions, and social responsibility and impacts. And I mentioned those 6 focus areas because we show up to deliver on our mission in those focus areas each year. So we do intend to do additional grant rounds on behavioral health, but that also means that we want to make room for the other upstream determinants, including economic inclusion, workforce development, creating future pipelines for the workforce, and more.
Okay, thank you so much. It sounds like you're doing some really important work.
Awesome.
I'd like to thank today's guest, Destiny Simone Ramjohn, the Vice President of Community Health and Social Impact at CareFirst BlueCross BlueShield. I'm your moderator, Nick Iannelli. For more on this discussion, visit WTOP.com and search CareFirst.